Research confirms that after 60 estrogen drops by more than 80%, leaving your intimate tissue thin, fragile, and slower to respond. If you rush or skip the right steps, you risk not just discomfort, but real damage. And that's why today I must reveal the 3 mistakes women over 60 cannot afford to ignore. My name is Dr. Eliza Hart. I am a board-certified gynecologist with over 15 years of experience helping women navigate menopause hormone changes and the unique challenges of intimacy after midlife. I've sat with thousands of patients who thought their discomfort was just part of aging, but in truth, most of these problems could have been prevented with the right guidance. Self-pleasure is not just about seeking comfort or release. Clinically, it's one of the most powerful ways to maintain circulation, keep pelvic muscles strong, and support natural hormone balance after menopause. But here's the paradox: the same habits that once felt normal in your younger years can actually harm your body now. That's why understanding how to do this safely after 60 is essential, not optional. So if you care about your long-term health, make sure to stay with me until the very end. Because the 3rd mistake is the one I see most often in my patients, and it silently steals away confidence and intimacy. Before we dive in, hit the subscribe button for more science-based advice on women's health and senior health. And type 1 in the comments if this message speaks to you, or 0 if you feel I should cover other topics for you. 1. Why self-pleasure matters after 60. So many women assume that after 60 intimacy is no longer relevant, that desire and pleasure naturally fade away with age. Yet clinical data and decades of medical practice prove the exact opposite. Your body still responds, still benefits, and still requires gentle stimulation to remain healthy. When estrogen levels fall after menopause, often by more than 80%, your vaginal tissue becomes thinner. Blood flow to the pelvic region decreases, and natural lubrication is less reliable. These changes are not signs that you are broken, but biological realities of aging. Without ongoing stimulation, the tissue continues to lose elasticity, the blood vessels slow down even further, and discomfort can quietly become part of daily life. Self-pleasure is not a luxury here. It is one of the most accessible and effective ways to counteract these changes. One of the most significant medical benefits is circulation. Each time you stimulate yourself, blood surges back into delicate tissues, carrying oxygen and vital nutrients that protect against thinning and dryness. This is the same principle we use when encouraging older adults to keep walking or exercising unused muscles atrophy, and the same is true for intimate tissue. By maintaining blood flow through gentle arousal, you are essentially performing preventive care for your most sensitive areas. Another overlooked benefit is lubrication. With estrogen decline, the glands that once responded automatically to arousal often slow down. This can make intimacy feel uncomfortable or even painful. However, when you regularly engage in mindful self-touch, you remind those glands to stay active. Even if the response is not as strong as it once was, the continued practice helps reduce everyday dryness, which otherwise contributes to irritation during simple activities like sitting, walking, or exercising. There's also a profound impact on emotional health. Self-pleasure triggers the release of oxytocin, the hormone of bonding and calm, as well as endorphins, the body's natural pain relievers. Together, these chemicals reduce cortisol, the stress hormone, and support more restful sleep. In fact, studies from the Women's Health Initiative highlight that older women who maintain some form of sexual activity report better sleep quality and improved mood compared to those who do not. In my own clinical experience, patients frequently return after incorporating gentle self-pleasure into their routine and tell me they feel lighter, calmer, and even more confident in daily life. Perhaps most importantly, this practice helps preserve the pelvic floor. As women age, the muscles supporting the bladder, uterus, and bowel gradually weaken, increasing the risk of leakage or prolapse. The contractions that occur during arousal and climax function as natural exercise for these muscles. Think of it as physiotherapy that you can perform privately, safely, and without equipment. Maintaining strength in the pelvic floor is not only about intimacy, it directly protects dignity, independence, and comfort in everyday living. When you recognize self-pleasure as a form of medical self-care rather than a guilty indulgence, you begin to see it in the same light as exercise or nutrition. But while the benefits are undeniable, the reality is that many women unintentionally undo these advantages by repeating old habits that no longer serve their changing bodies. And this is where the first common mistake comes into focus. 2. Mistake number 1, rushing. One of the most common issues I see in my practice is women who approach self-pleasure with a sense of urgency. For decades, many of you may have learned to be discreet, to finish quickly, or to avoid being noticed. That habit may have worked in earlier stages of life, but after 60, it is not only unhelpful, it can be harmful. Your body has changed, and the tissue you are working with is now thinner, more fragile, and slower to respond. If you try to force it to react at the same pace it once did, you create friction before the body is ready, and that friction can lead to irritation, dryness, and even micro tears that are painful to heal. From a physiological standpoint, this is entirely predictable. Blood vessels that once responded quickly to arousal now dilate more slowly. Nerve endings require more consistent, gentle stimulation to transmit pleasurable signals. Vaginal and vulvar tissues lacking the same estrogen support they once had need additional time to expand and lubricate naturally. When you skip over that process, the body perceives it as stress, not comfort, and instead of experiencing relief, you may end up with soreness, burning, or an aversion to intimacy altogether. In my consultations, I often remind women that intimacy after 60 should be thought of as a slow warm-up rather than a race to the finish line. Just as you would never expect your joints to handle a sprint without stretching first, you should not expect your intimate tissues to tolerate sudden intense stimulation without preparation. The concept of patience here is not indulgence, it is medicine. Allowing yourself 10 to 15 minutes simply to relax, breathe, and let circulation build can completely change the experience. Many of my patients who made this adjustment were astonished by how much more comfortable and satisfying their routine became once they stopped rushing. There is also an important emotional component. When you rush, you send a subconscious signal that this act is shameful or secretive. That mindset increases tension, shortens the breath, and prevents your body from fully engaging in the process. By giving yourself time, you are not just protecting your physical tissue, you are also retraining your nervous system to view intimacy as safe, natural, and restorative. Practical strategies can make this easier. Choose a private environment where you feel secure, free of the need to hurry. Consider a brief warm shower to encourage blood flow before you begin. Focus on gradual, gentle touch rather than immediate pressure. If thoughts of guilt or urgency arise, redirect yourself to the idea that this is part of your health routine, as vital as taking your vitamins or walking each day. With consistency, this slower approach becomes second nature, and the body responds with more comfort and less resistance. What women often discover is that patience is not a limitation, but an enhancement. By giving your body the time it requires, you unlock deeper relaxation, greater lubrication, and more reliable arousal. Instead of battling your biology, you work with it. And that cooperation brings not only pleasure, but healing. Recognizing that intimacy is no longer about speed, but about presence, can transform the way you experience your own body. And once you embrace this new rhythm, you will be better prepared to correct another mistake that quietly undermines health for so many women after 60. 3. Mistake number 2, skipping lubrication. Among the most overlooked yet critical aspects of intimacy after 60 is the use of lubrication. Many women hesitate to reach for it either because they feel embarrassed, assume it is unnatural, or simply because they have never needed it before. In earlier decades, your body may have produced moisture quickly and reliably, but that biological response is no longer as strong once estrogen levels decline. When you ignore this fact and continue without additional support, you expose delicate tissue to unnecessary strain, and the consequences often appear as burning discomfort or even micro tears that make future experiences less appealing. From a medical perspective, lubrication is not optional, it is protective. With age, the glands that provide natural moisture reduce their output dramatically, and this dryness is one of the leading causes of pain during intimacy. Studies from the North American Menopause Society report that up to 60% of postmenopausal women experience vaginal dryness, severe enough to affect daily comfort. Left unaddressed, that dryness can contribute not only to discomfort during self-pleasure or partnered intimacy, but also to urinary tract infections and chronic irritation that reduce quality of life. The simple act of adding an appropriate lubricant significantly lowers those risks and makes the experience safer. Fortunately, there are many safe, effective products designed specifically for sensitive tissues. Water-based lubricants are widely recommended because they are gentle, easy to clean, and compatible with most devices. Silicone-based options last longer and may provide added protection for women with pronounced dryness. Choosing fragrance-free hypoallergenic formulas further reduces the risk of irritation. What matters most is not which type you choose, but that you allow yourself to use it freely and without guilt. In my consultations, I often remind women to think of lubricant the way they think of reading glasses or moisturizer, not a weakness, but a supportive tool that lets the body function more comfortably. How you integrate lubrication into your routine is just as important. Applying it not only to the surface of the tissue, but also to your hands or any device ensures smoother movement and less friction overall. Reapplying as needed is perfectly acceptable and in fact recommended. The goal is to create an environment where the body feels supported instead of forced, so that pleasure can unfold without pain or resistance. Women who accept this adjustment often tell me how transformative it is. One patient in her late 60s admitted she had avoided intimacy for years because it always ended in discomfort. When she began using lubrication consistently, she not only enjoyed the experience again, but also noticed less irritation in her daily life. Stories like hers demonstrate how a small, practical change can restore both comfort and confidence. Now, I would like to hear from you. Many women quietly wonder whether others their age are using lubrication, but rarely speak about it. If you feel comfortable, share in the comments whether you have tried lubrication after 60 and how it influenced your comfort. Your words might be exactly what another woman needs to feel reassured and less alone. By reframing lubrication as an essential part of self-care, you protect your tissue, prevent complications, and create a foundation for safer, more enjoyable intimacy. Once you take this step, you are ready to look closely at another powerful factor, the role of your emotional state in shaping every intimate experience. 4. Mistake number 3, ignoring emotional state. When concerns about intimacy arise after 60, most attention goes to physical changes, dryness, thinning, tissue, or slower arousal. Those are real, but the mind often decides how the body responds. Your emotional state shapes arousal, comfort, and satisfaction, and overlooking it can quietly sabotage even a careful physical routine. In practice, I see a consistent pattern. Women who carry guilt, shame, or the belief that pleasure is wrong tend to hold tension, breathe shallowly, and struggle to relax. Stress hormones such as cortisol increase when intimacy feels secretive or unsafe. Elevated cortisol interferes with oxytocin and dopamine, two chemicals that support warmth bonding and pleasure. In short, the body rarely opens when the mind is closed. Medical evidence supports this link. Psychosexual research shows chronic stress correlates with lower desire and higher rates of pain during intimacy. Under stress, pelvic floor muscles tighten and blood flow declines, which magnifies dryness and discomfort. What appears to be a purely physical problem is frequently rooted in emotional strain. Addressing the mind is therefore not cosmetic, it is therapeutic. The good news is that the nervous system can relearn safety. When you approach self-touch with acceptance rather than judgment, breathing deepens muscles, soften, and arousal becomes more reliable. Many patients notice meaningful change simply by giving themselves permission to slow down and view the practice as self-care instead of a secret. Practical steps help. Start by creating a calm environment, privacy, soft lighting, and quiet sound. Spend 2 to 3 minutes on paced breathing. Inhale through the nose, exhale fully to lower arousal anxiety and invite circulation. Some women benefit from brief mindfulness, noticing sensations without evaluation. Others prefer simple affirmations that reframe pleasure as health maintenance. If strong emotions arise, pausing is appropriate. You are not behind, you are teaching your body safety. If past experiences or beliefs still weigh heavily, guided support can accelerate progress. Pelvic floor physical therapists, sex therapists, and menopause-trained clinicians routinely help patients reduce pain and rebuild confidence. A few sessions often clarify what is physical, what is emotional, and which habits to modify first. Consider a real-world pattern I encounter often. A woman in her 70s avoided intimacy for years because of persistent guilt. When she reframed self-pleasure as a medical practice for circulation and pelvic health, she reported improved comfort, less fear, and better sleep. Her tissues did not change overnight, but her nervous system stopped bracing, and that shift unlocked progress that creams alone had not achieved. I encourage you to reflect before your next session. Ask what emotion is present right now. Pressure, worry, or curiosity? What would make this feel safer? Time, privacy, or breath? Share a brief note in the comments about what helps you relax or what you still find challenging. Your experience may give another woman a starting point and reduce the sense of isolation that keeps many silent. When guilt recedes and compassion grows, the body cooperates. Caring for both mind and tissue creates conditions where intimacy becomes restorative, not stressful. In the next section, we will bring these insights together into a science-based routine designed for women after 60. 5. Safe routine plus health benefits combined. After understanding the importance of slowing down and addressing both physical and emotional needs, the next step is to adopt a safe, science-based routine that supports comfort and long-term health. Many women ask me, "Doctor, what is the right way now that my body has changed?" The answer is not complicated, but it does require patience, consistency, and respect for what your body needs after 60. The first element is preparation. Begin with hygiene and privacy. Wash your hands thoroughly, gather a soft towel, and choose a quiet environment where you feel secure. For many, a bedroom with the door closed or a bathroom after a warm bath works well. These simple steps send a message of safety to your nervous system, lowering tension and making the body more receptive. Next comes relaxation. A warm shower or bath is more than a comfort ritual. It increases circulation, loosens muscles, and primes tissue for stimulation. Gentle stretching or deep breathing can amplify this effect. Even 2 to 3 minutes of slow, steady breaths can calm the nervous system and encourage blood flow to the pelvic region, which is essential when natural vascular responses are slower than they once were. Lubrication is the third essential component. As we discussed, dryness is nearly universal after menopause, and external support is both safe and recommended. Choose a water-based or silicone-based product that is free of fragrance and harsh chemicals. Apply it generously not only to the tissue, but also to your fingers or any device you plan to use. Reapply as necessary. Consistent use protects fragile tissue, reduces friction, and allows you to focus on sensation rather than discomfort. Once prepared, approach the act as exploration rather than performance. Begin with areas outside the genitals, such as the thighs, abdomen, or chest. This gradual stimulation awakens nerve endings and builds circulation. Move inward only when you feel comfortable using light strokes or circular motions. If you enjoy devices, select those designed for gentle intensity rather than high power. At this stage, less force often leads to greater sensitivity. Always monitor how your body feels and pause if any discomfort arises. Equally important is aftercare. Take time to rest, hydrate, and clean the area with mild, unscented soap if needed. Treat this stage as part of the practice rather than an afterthought. Resting for a few minutes allows oxytocin and endorphins to circulate, promoting calmness and better sleep. The benefits of following this kind of routine extend far beyond the moment. Regular, gentle self-pleasure enhances circulation, which preserves elasticity and helps prevent atrophy. Pelvic floor contractions during arousal serve as natural exercise, reducing the risk of leakage or prolapse. Hormonal responses, though different from earlier years, still include oxytocin and dopamine, both of which lower stress and improve sleep quality. Studies from the Women's Health Initiative have confirmed that older women who maintain sexual activity report fewer urinary symptoms and better emotional well-being compared to those who do not. When you view this practice not as indulgence but as preventive medicine, it becomes easier to commit. Just as you walk to maintain heart health or eat vegetables to support digestion, mindful intimacy preserves circulation, muscle strength, and confidence. The long-term reward is not only comfort, but also a deeper sense of dignity and vitality in everyday life. If you are just beginning to reintroduce self-pleasure after 60, the most effective approach is to start gradually. There is no need to pressure yourself with a strict schedule. Instead, begin with short sessions once or twice a week, lasting only a few minutes. This allows your body to reacquaint itself with gentle stimulation without strain or expectation. During the first week, focus solely on preparation and relaxation. A warm bath, deep breathing, or light massage of the thighs and abdomen may be enough. The purpose here is not climax, but circulation and comfort. Once this becomes familiar, you can begin to add gentle external touch, using lubrication, always checking in with your comfort level. By the second or third week, consider lengthening the sessions slightly and exploring different motions or areas of the body. There is no right or wrong technique, only what feels safe and nourishing for you. If dryness is still noticeable, try applying lubrication earlier in the process or experimenting with a different formula. Many women find that water-based products suit daily comfort, while silicone-based lubricants provide longer-lasting support for intimacy. For those who have avoided intimacy for years, it is common to encounter emotional hesitation. Instead of forcing progress, acknowledge those feelings and treat them as part of the process. A simple journal entry or affirmation such as, "This is self-care, not shame," can help shift the mindset. Over time, consistency matters more than intensity. Even gentle, mindful sessions maintain circulation, strengthen pelvic muscles, and reduce discomfort in daily life. Think of it as a health practice similar to stretching or walking. With patience and compassion, each step you take supports both physical resilience and emotional confidence. As we come to the end of this conversation, let us pause and remember why it matters so deeply. After 60, your body changes in ways that are undeniable. Estrogen levels decline, tissues become thinner, and natural lubrication slows. These are not signs of failure, but signals that care and attention are needed in a different way. By avoiding the 3 common mistakes, rushing, neglecting lubrication, and ignoring emotions, you protect yourself from unnecessary discomfort and open the door to renewed vitality. The safe routine we explored is not complicated, but it is powerful. Preparing with privacy and warmth using lubrication, consistently moving slowly with patience, and caring for both body and mind all serve a larger purpose. They preserve circulation, protect delicate tissue, strengthen pelvic muscles, and release hormones that improve sleep and mood. Most importantly, they remind you that intimacy is not a closed chapter. It is still an essential form of self-care. My advice to you is simple. Begin gently. Stay consistent and treat this practice with the same respect you give to nutrition, exercise, or rest. When approached with compassion, self-pleasure becomes more than a private act. It becomes a form of preventive medicine, protecting your confidence and your dignity for years to come. I want to thank you for staying with me through this important discussion. Your willingness to listen, reflect, and learn shows that you still honor your health and your sense of self. If today's message resonated with you, please support this channel by subscribing and leaving a comment below. Your thoughts not only encourage me, but they may also be the reassurance another woman desperately needs. Together, we create a community where no one feels invisible.